Okay, well, we will go ahead and get started. So, welcome again to the Nursing Network on Violence Against Women International webinar series. We're excited to welcome you wherever you are. So, good morning, good afternoon, and good evening. We are very excited to be hosting an excellent speaker from Thailand. We are honored to have Tipparat join us. Tipparat has also been instrumental in planning our next conference that will be taking place in Thailand in November. So we're hoping to have a few minutes at the end of the presentation to get individuals excited about traveling to Thailand if you'll be joining us in person. So Tipparat, and I'm going to do my best to do these pronunciations, but Tipparat, please correct me if I get any of these wrong. Tipparat Udmuangpia is a nurse instructor at Boromorajani College of Nursing Khon Kaen under the Faculty of Nursing at the Praboromajarnak Institute in Thailand. Her research focuses on intimate partner violence prevention and healthcare responses, including effective screening methods, interventions, and essential safety resources for intimate partner violence survivors. She is the recipient of an NIH K43 Research Funding Award for her project titled Cultural Adaptation of a Web-Based App, which is My Plan Thailand, to empower and support friends and family of intimate partner violence survivors. And we are very excited to hear more about Thailand's research journey towards an mHealth-enabled IPV intervention. Before I turn it over to Tipparat, please feel free to use the chat throughout the presentation. If you have questions, we'll try to save most of the questions for the end. However, if we have a clarifying question or something pertaining to a slide, then I will interrupt Tipparat to see if we can address those questions. And we look forward to learning more about your work, Tipparat. I will turn it over to you.
Thank you so much, Dr. Michelle, for the introduction. I really appreciate that. Good morning, good afternoon, and good evening, everyone, again. So I'm so excited as well to share about my research journey regarding intimate partner violence research in Thailand. Yes, you pronounce my name is correctly. Thank you so much. So let's talk a little bit about myself. So I am a nursing instructor and I'm graduated in my bachelor degree in nursing from Boromrajani College of Nursing Khon Kaen in Thailand. And also I finished my master degree in caring science from Mälardalen University in Sweden. That my thesis was done in teenage pregnancy. And after that, I finished my PhD in nursing and health innovation from University of Missouri from the US. And, after finishing my PhD, I have opportunity to be a visiting scholar at Johns Hopkins University and Notre Dame of Maryland University in the US for doing research and training research in intimate partner violence. So let's talk about my research journey in Thailand. Actually, when I counted my research, I thought that, oh, okay, have some, some research to talk about. So I had done about 10 research in Thailand regarding intimate partner violence, and I will talk more about each in the slides on that. This is my journey. That finally right now I'm doing research about cultural adaptation of a web-based app to empower and support friends and family of intimate partner violence survivors. That actually I I have been adapting from the My Plan app from the US to Thailand. And the app that we found in Thailand, we call WeSafe. So this research, we got funding from the National Institute of Health on that. So let's thank you so much. Let's talk a little bit about. So as you guys, you guys are violent researchers. Let's talk about prevalence of IPV in Thailand. So as a global prevalence, 1 in 3 women who have experienced physical and or sexual violence in globally. But Thailand, when we look through study in 2021, we found that we have 9% of women have experienced IPV in the last 12 months. And 24% of women have experienced IPV in their lifetime. So about, 1 in 4 women, Thai women, who have experienced abuse in physical and or sexual abuse. Of course, violence is totally underreported in Thailand. So, the number that you found, it would be more than that for sure. And Thai women who screen IPV positive for the past year, we found that, over 50% of them, they have depression symptoms. And 17% of them reported attempting suicide on that. This is very, is a sad number for sure. It is interesting for researcher to look through that. However, even though IPV is prevalent in is common in Thailand, and Thailand we do have resources. It's called One Stop Crisis Center. That the One Stop Crisis Center is the first, has been established in 1999. It's about 25 years ago that they have been integrating in all hospitals in Thailand that started from Ministry of Public Health. And also for this model and this approach, in 2015, we got the UN award about the topic about gender equity that OSCC has been doing on that. However, even though Thailand has excellent resources as OSCC that contributed in all hospitals, there are things that we need to improve for helping survivors for sure. So let's talk a little bit on that. Before I would talk about my research, I would like to talk about the story that inspired me a lot after I came back from the US to study and doing research in Thailand about IPV. About 3 years ago, we have survivors. She was a nurse, and at that time she was doing her job at the hospital, at the tertiary hospital, and she was a survivor. She was an intimate partner of violence survivors. She got 2 children on that, and she had been separated with her ex-husband for years, but her ex-husband tried to reach out to her and kind of thing. So at that day, she was working at the hospital, and she brought her children with her at the hospital as well at the night shift on that. Around 8 p.m., her ex-husband, came to the hospital and shot her from the gun. And yeah, she died in front of her children. and her husband died too. So this story, came across to my heartbreaking that violence is common, but is still private talking about this in Thailand. And for these stories, he tried to reach out to formal resources, but they have some stigma for sure that we need to figure it out on that. So yeah, this story inspired me a lot for doing research in Thailand. So when I came back in 2019 for my PhD, I I have commitment that I would do research in intimate partner violence. However, we don't have a screening tool for screen and for identify women who have experienced abuse. So first of all, I adapted the screening tool. I adapted the woman abuse screening tool or the West for Thailand, and also adapted the danger assessment in Thai version as well. We conducted in using the Delphi method and in-depth interview with the experts on that. So we got the tools, right? And after that, we would do research. And we thought that, after the interviewing, talking to the experts, talking to the survivors, we have absorbed that violence is totally related to the mental health, especially about PTSD and CPTSD as well. At that time, Dr. Tina Broom, she's my PhD advisor and my research partner as well. She's been in Thailand for the Fulbright Scholar. She told me that, Tipparat, let translate the PTSD and CPTSD screening tool for Thailand, for Thai version, that you can see, and if people who are interested in, you can go through the trauma measureglobal.com, and you will see a lot of versions, a lot of language versions on that. So it's including Thai version as well. So we have the tools, we have the wares, we have the danger assessment, and we have PTSD and CPTSD screening tool for using the research in Thailand. And after that, we thought that let's start the research in pregnant women, because I'm a nurse instructor, that I'm a midwife in Thailand. So kind of like I have been seeing a lot of phenomena about pregnant women who have unwanted pregnancy, or kind of like I have a sexual abuse and got pregnant on that. So we did we did the prevalence of IPV forms, including a physical, sexual, and psychological violence among pregnant women by using the WES. And if the WES is positive, we use the danger assessment for that as well. So we use that, and we ask participants, we ask pregnant women. So we got 471 pregnant women screened and 340 eligible for the study. We found that physical abuse was 7.1%. Emotional abuse was 47.4%. Sexual abuse was 8.2% on that. And women with pregnancy complications had significantly higher IPV severity score on that. And women who experience stress in the last 2 weeks had significantly higher IPV severity score on that as well. So this kind of this research was conducted in 2021. That the last research in Thailand the last research conducted pregnancy in Thailand among pregnant women with IPV would 10 years ago. This is the updated research in Thailand about this. So when I show this research to the results to providers, to healthcare providers in antenatal clinic and also the one-stop crisis center, they kind of it was surprised with them. And also they said that they believe that the prevalence in IPV among pregnant women would have been higher as well. And after that, so we use the West for the pregnant women, Thai pregnant women. And also when Tina Bloom, she was in Thailand for the Fulbright Scholar, she was leading the research about danger assessment Thailand, assessing the risk for re-assault in abusive, for Thai abusive on that. So we had done for 2 steps. For the step 1, we developed the danger assessment. Again, kind of we revise on that. So we did we did literature review, we did clinical and research expertise to look through together. We did a Delphi study, interview with Thai IPV survivors. So we got 40 items of the DA for Thai version before we did research. So we got the 40 items. And after that, we use that items to do longitudinal prospective cohort study that we recruited Thai women who have been at the ages at least 18 years old, screening positive for IPV, and also they have to test they have to screen by using the West, and also if the West is positive, they would continue for the DA after that. So we did that, and also we did for 4 months after to see the re-assault abuse on that. You will see more information and the risk factor on the detail on that for the NNVAWI in Phuket that Dr. Tina Bloom will present on this as well. So and also for the measures on that, we use the ITQ, that including PTSD, CPTSD. We use the DA Thailand. We use the social ecological measures on that as well. So we did that during the pandemic, COVID. This study, it was the first study in Thailand that had done by using online during the pandemic with the sensitive topic on that. So for the results, we found that 708 screen, 688 eligible for our research. And we found that we got 296 who have been have a IPV positive, and 279 in baseline data. So there are very interesting information and a lot of things that we can, we can use the information for doing the next study on that. So we found that from the mental health, clinic, clinically significant depression symptoms, we found 50% of them have depressions on that. And suicidality for past 2 weeks, about 50.5% as well. And also, we found that 90% of participants never access to the OACCs or the hotline or the NGOs that we have been provided for that. So this number is very important for us, that why we just cover for 10%. How about 90% of that? So we discussed about this number, and this number brought us to the K43 funding for that, to do the My Plan app, to do the WeSafe app for Thailand. And also for the cultural specific factors, 59% of participants believe that partner is abusive because of her own karma. Do you guys know about karma? They believe that in the past life behavior. So this life is kind of like they have to do to, because of the past life on that. And also about 28.8%, they believe that one life, one husband. They believe that if they marry with a guy, for this guy, it would be forever with this guy. Yeah, and we got the risk assessment items that is very interesting on that. If you guys see the danger assessment for that. So we found that the high literacy, we got 67.4%. Cyber stalking, 59.5%. The biggest person in family that they believe is would be 59.1% on that. So you would see the items on this. This is the most frequency. You would see that it's including, it's including cultural belief, like Thailand. When we talk about violence, it's still the private matters, and would make them destroy their face family on that, their like a family image or kind of thing. Yes. So this is the most serious DA item for the part one that you will see this one. They believe that abuser could kill her for 37.3%. It's very dangerous for women. So when Dr. Tina and we discuss and we absorb the results from that, we thought that, oh my God, we need to do something to make sure that Thai survivors would be safe from that. And after that, for that one, we thought that, after we talking to the healthcare providers, we thought that healthcare providers, sometimes they need to train about intimate partner violence, because when we talk about violence in Thailand, the sense of violence for Thai people, they would think about like domestic violence. They haven't thought about intimate partner violence much, including providers. So we from that situation and from that findings on that, we developed the training programs for the healthcare providers regarding screening intimate partner violence and substance abuse. So we use the curriculum from the World Health Organization. You can see the LIPS model that the World Health Organization, they launched the training program for providers in low and middle income country. So I found that and thought that would be very helpful. So we translated uh, from English version to Thai version to train healthcare providers. And we developed the training program from that during the pandemic on that. So it's very, I can tell that it's very popular for this as well, because when we thought that it would be 40 participants would be interested in this research, but within 20 hours, we got participants, like 85 participants who interested in. So is needed for that. So we train by using the LIPS model. The LIPS including listening, inquiry, validate, enhance safety, and support for that. So we trained for 5 days when we started. We started for 5 days, and we developed and we use kind of like they have to have lecture for 2 days, and have been trained like a training in clinic to screen for 2 days, and 1 day for discuss and kind of thing. So it's very helpful, and healthcare providers, when they use the screening tool, including the WES, we developed the HAWK as well, and we integrated the substance abuse question on that as well. So we use this one. This is a Thai version on that. It's for 1 page that they have to ask the participant. It's very interesting that they practice at the antenatal clinic, at the drug unit, kind of like a substance unit. They found that almost 50% of participants walk into the clinic and they have been positive results from the IPV on that. So would make participants, would make the providers thought that, oh, it's very important and it's needed to do this. Yeah, we did the longitudinal study, kind of like so after training for 1 month, we asked them about their attitude, subjective norms, and perceived behavioral control for doing screening the IPV for that. So we found that experienced IPV screeners were 8 times more likely to screen for IPV than those without experience. And also providers who have own experience, they have more likely to screen IPV as well. So for this screening tool, that providers, they use this recently to use it at their hospital as well. So after that, after we trained that, we thought that future providers would be very important to know and to have the mindset, to have the attitude about IPV screening and to aware about this as well. So we examine the future nurses, like nursing students across Thailand, the last year of nursing curriculum, nursing program on that we asked them about the intention of IPV screening. So we found that we got 639 senior nursing students across country who participated with us. And we found that the attitudes and subjective norms were mediators of the relationship between providing a tool at clinical site and intention to screen. But perceived behavioral control was not a mediator. So it's kind of like this result is different from other results because other they found that perceived behavioral control kind of like is a significant factor to do that. So, and another interesting that nursing students, future nurses, they had intention to screen about 90% of them. They thought that's very important, but they don't know how to screen. They don't have any confidence, any things to do that. They thought that if it's positive, what the next step that should be kind of thing. So for this story, for this research, so right now in my nursing school, I added the intimate partner violence integrated in nursing subjects, in community health nursing, and also in midwifery courses as well. Yeah, from the results of the research in Thailand, that the journey of that, Dr. Tina and we thought that that you guys would know that the My Plan app the My Plan app is very popular in the US. And when I was in the US for my PhD, and I had opportunity to learn about what My Plan app working on that. So we thought that we would bring the concept of the My Plan app for adapting it for Thai culture, for Thailand. So we did a research about feasibility of the My Plan app in Thailand. So we did qualitative research with 7 focus group and 1 in-depth interview in Khon Kaen province in my hometown. We asked healthcare providers. We asked 4th-year nursing students. So the results, we found that they thought that the My Plan app kind of like we didn't mention much about the My Plan app, but we mentioned about technology, the mHealth and kind of thing that would be integrating and make people to access the resources from that. So they thought that, we found that the possible users for using the app, that would be IPV survivors for sure, and also college women, healthcare providers, that they would be useful for that. And the recommended resources, they share that in Thailand they have, we have resources, we have OSCCs, we have NGOs, kind of thing that would integrate to the app. However, they have potential challenges that we need to consider, including limited internet access, especially in rural areas, referral system that we need to revise and make it seamless to integrate to the app, and also provider readiness that we need to talk and train providers as well. So for this one, so we committed to develop the app. We looked through Thailand. So Thailand, before this, they have I Can Plan app for intimate partner violence survivors that they use that. But this app very, very popular and very helpful, that people, they look through that and they access to the app, and they screen themselves and they would see the resources on that. But this app haven't shown about the safety planning, kind of the safety planning, the priority or kind of thing. So we thought that we would integrate, we is needed and it's time for adapting the My Plan app for Thailand to have to add the safety plan and helping strategies on that. So we submitted the funding from the NIH for the K43 for 3 times. Luckily, luckily that we got it for the 3rd time. So we got we got the funding. The title that we submitted is Cultural Adaptation of a Web-based App to Empower and Support Friends and Family of Intimate Partner and Survivors in Thailand. So this is for friends and family, right? 2 times that one time, the first time and second time that I submitted for survivors. The app for survivors. But when we found the results, 90% of Thai survivors who didn't know about the resources. So we thought that, okay, let's flip and to do with friends and family and kind of like a social support for that. Luckily that we got that. And so we got it. Right now it's not My Plan app, but it's called We Save app for Thailand. So this is my mentor for the K43 for my research. They are very helpful and I owe them a lot for this. Without them, I could not be today to talk to you guys for this. So this is the team for that. So it is for 4 years. Right now I'm starting my 3rd year and I had done for my phase 1. For the K43, kind of adapting the app for Thai people, the mHealth for Thai people. You will see this number, right? That is 90.4% of participants never access OACC, hotlines and NGOs and other formal parent resources for that. The aims for this study that we would like to tailor the app content for concerned friends and family members of Thai IPV for the phase 1, and also integrate the app contents for concerned friends and family of Thai IPV survivors, and also test the feasibility and acceptability of adapted My Plan app with concerned friends and family. That would be phase 2. So this is an overview of my study that 4 years. My first 2 years, there's M1 and M2, and this is M3 for that. So I finished my phase 1. So right now I'm starting my M2 that I will do the RCT longitudinal design to have 100 friends and family. So Dr. Michelle, do I talk fastly? Is it okay for that?
You are okay on time, Tipparat. We have about 20 minutes left.
Okay, thank you so much. So the research progress for that I interviewed 27 survivors, interviewed 26 friends and family, to ask them about feasibility, about the, for adapting the app, the M Health for Thailand for that. So I would like to share the result to you guys. This is the first webinar that I share this result on that. And after that, I will talk more the details at the NNVAWI for this research as well. So we got that this is the health seeking among intimate partner violence survivors in Thailand. I did a qualitative research study from that. So we asked 27 Thai women survivors of IPV. We recruited participants from social media, from community partners, OSCCs, and NGOs. We have the flyers and let them if they are interested, they would look through the link and they would screen by using the hawk, and by using the hawk, if they have been positive, we would screen them and interview them about that. So about the health seeking of survivors, we found that survivors have, some survivors, they have positive experiences of health seeking. They thought that their friends and family and also formal resources make them have like empowered to fight their life, to stay their life, and also help them to have safety planning and encourage them to prioritize health, especially about mental health and physical health as well. So for the safety planning, they told us that especially if they talk to healthcare providers, like a formal resources, the nurses or social worker would make a plan with them about safety planning for that. However, they said that they have, barriers about seeking for help, including they have fear of judgment from friends and family, from the healthcare providers, and also cultural attitudes. When they talk about it, that they would, people that they talk, they would thought that they are like they would do something wrong about that. And also lack of awareness of resources. They don't know about OSCC. They don't know about the hotline, 1300 and kind of thing. They don't know about that. That are the barriers that we have found. And the factors that make them delaying of health seeking is including their concerns for children, that they thought that when we talk about family, it would include father, mothers, and children, kind of thing, that they concern children feelings, and experiencing only emotional abuse, kind of like a Thai survivors. They thought that if they have just only they feel sad, they feel depressed, they feel low self-esteem, they have to be patient with this. They kind of if it's just only emotional, they would be okay to be patient, to be silent. But if it's like a physical abuse and make them have injuries and make them go to the hospital, they would inform and disclose about violence on that. And societal stigma, for sure, that when people know about if they know about that, they are survivors, that they would have stigma in their societies and would make the impact for their jobs and kind of thing. So, and also we asked them about strategies to increase health seeking. They share us that if survivors have been educated about resources, about hotlines and safety planning, that would make them safe on that. And also technology would help them to access the resources. You would be surprised that Thai people, 90%, like 90 of Thai people, they have the Wi-Fi, they have smartphone, and they have Wi-Fi, and they have um, Facebook profile and kind of thing. So kind of like they use social media widely on that. So they thought that if we integrate with the technology, that would be very helpful. Yeah, we got that information, and I can tell that this is my personal experience that I would like to share with you guys. If someone would like to do research in adapting the app to their houses, I would say that it's very difficult. For me, it's very challenging. That when I was studying my PhD and I had opportunity to work with Dr. Tina Broom and had opportunity to see Dr. Nancy Glass, kind of thing, kind of like it seemed like oh, okay, I think I can do it for Thai people or for Thailand, but for the real situation is totally struggle with things on that. But I learned a lot from that. And right now I set up the VSafe app that, this app including the input from participants, from advisory board committee, from healthcare providers and kind of thing. So we have 5 structures on that. We have the relationship part, we have the health strategies, we have the resources, we have my learning, we have the chatbot on that as well. This I just added the chatbot on that. So these are the examples of the apps. If someone, if you are interested in, you guys just, click on www.vsafeapp.com. You will see on this, but it is a Thai version on this. So this I translated in English. So we try to use the pictures or videos or kind of like a variety of social media that would make users to engage with the app on that. So I for the relationship, for the first one about relationship, we do have danger assessment, we do have red flags, we do have toxic relationship that people would screen for that. And after that, we have strategies that that friends and family would engage and look through it and educate themselves, and would use it for their survivors on that. You will see, a lot of pictures that my team, they, try to make sure that people would engage on that. Yeah, for this one, for my study, my primary outcomes would be supportive safety behavior, and my secondary outcome would be distress and frustration on that. I can share my slides as well. Um, for the next step for adapting the WeSave app, so I would do the pilot RCT with 100 friends and family. And after that, we will submit the RO1 or R34 for examining the effectiveness of the WeSave for survivors, social support, like friends and family in Thailand. And the next step for IPV research in Thailand that is in my mind that WeSave, I plan to adapt the WeSave for IPV survivors. We already have IPV for social support, and we would like to have IPV for survivors and also for healthcare providers as well. So we will training healthcare providers. We will enhance the accessibility of the OSCC by integrating with the technology and mHealth for that. These are my research journey. So, a lot of things coming tonight for sure. I would like to acknowledge and gratitude for these people that they help me and support me with everything and every time that I need that. Without them, I could not be today. Dr. Tina Bloom, Dr. Nancy Clare, Dr. Supawadi help here, Dr. Nancy Porin, Dr. Jane, Amber, and Dr. Vishai for this. Thank you so much. And and this is my OSCC team that we work together for the adapting the WeSave app for that. This app is not my own app, but it's for Thailand app for that. So they are very lovely and very supportive for that. So that's my research on that. And I would like to invite you guys for the NNVAWI 2024. If you guys haven't decided yet and haven't registered for the conference, we will do for we will do in Thailand, in Phuket, Thailand, in on 13 and 15 November on that, and you will see the beaches in Thailand. I think the beaches are calling you guys to Thailand, and you will see, things, cultures, and the hotel. This is the hotel that we will be hosted for you guys. A lot, swimming pools around the hotel, and in front of the hotel, there is the beach on that. It's time for you guys to be relaxed. And you will see the Loy Krathong festival as well. So it will be on November 15th. And at Phuket they have Loy Krathong. Yeah.
Thank you so much, Tipparat. You're getting some congratulations and thanks in the chat. And one of your colleagues also alerted us that it's your birthday. So happy birthday.
Thank you so much. Yeah, thank you so much for giving me opportunity for sharing my research today and sharing about NVAW. I am so excited to welcome you guys into the.
Great. So we have about 5 minutes left, and you gave us a lot of wonderful information to think about. We're a relatively small group today, so I would say if anyone has questions, if you want to raise your hand or unmute, or as always, you can use the chat. But it sounds like we'll have time in Thailand if anyone is traveling to the conference to talk more about this work as well. Yes, go ahead.
Hello, you hear me?
We can hear you, yes.
Okay. First of all, thank you so much for your sharing, Tipparat. Your project really wonderful. You have made a significant impact on addressing intimacy partner violence in Thai people. However, I would like to raise an issue as many Thai women perceive as unacceptable violence at their karma. I think it means that this perceive is mean they are suppressive and I believe they have no options in life. And as I believe there needs to be two-way communication in your project addressing both availabilities of healthcare services and accessibility for victims. While you are having progress in approving the availabilities of service, your finding highlights significant barriers to accessibility, such as lack of awareness about resources and, in some cases, acceptance of their situation. My question is, are there any future projects or next steps you are planning to pursue to empower Thai women not to tolerate this violence?
Yeah, thank you so much. It's very great patient and the thing that we try to learn and talk and discuss about this. I can tell that from my experiences of interviewing IPV survivors, um, they, you know, yeah, I agree that sometimes they don't have many things to do because they depends on something from their husband, like their money, their house, and kind of thing that make them feel like I have to do that. This is my karma for that. But I throw these questions to my participants, to IPV survivors about this. They thought that if they have, like, if they educate themselves and if they have jobs, if they have be independent, they would live and they would, step out from that situation. So for me, the things that I'm thinking that, try to make women to have the jobs and have a confidence of themselves and have attitude that balance is not karma on that. And yeah, this is my thought at that time, and I'm welcome to learn from you as well.
Hello,
Hello.
Tipra. I noticed there's a question also in the chat. I will be brief. Michelle suggests me to go next. Thank you for the great talk and the very inspiring, very important for Asia with huge needs and to learn and to nurture this important type of work. So I noticed I met you at NNVAWI in North Carolina, and I think you presented the study on IPV during pregnancy. So I wonder what's the opportunities and challenge to have more study to nurture this area in Thailand. Looking forward to meeting you in Fuji Island. Thank you.
Thank you so much, Queen Lee. It's nice to see you here today again. Yes. Yeah. While I did this, I studied about IPV, and also I had opportunity to interview them. I interview 50 participants on that. They said that kind of like they just want someone to hear and to be beside of them. Kind of like they feel lonely on that, and also when we do research, so IPV is not just only for mental health of pregnant women, but also for physical and complications as well. So when we need more research, clearly, we need more research about doing research in pregnant women that have related to preterm birth, related to stillbirth, and kind of thing. So I agree that we need to do research. We have a lot of rooms for us for doing that.
Thank you. Thank you.
Tipparat, there was one more question in the chat. I do realize we're a couple of minutes over time. So I just want to thank everyone for joining. Dr. Tipparat did share slides, and I will send those out with a recording to everybody that registered for the webinar. And then we'll also make those available on the Nursing Network on Violence Against Women International website. So the last question I see here in the chat is, can you talk about how you have managed safety considerations for survivors while working with friends and family members?
It's very great questions, Daphne, and I thought that you have been facing with this issue as well. Yeah, and it's very, very sensitive things to do. I did in several things for that. I definitely, yes. Let's talk to my research, it's kind of like I haven't do I separated participants, like interview with survivors and also friends and family that different. It's not like you not diet on that. So that's why this issue we haven't come out with that. But it's very important. This one that I'm thinking to do on my pilot RCT as well. And I would like to learn from you as well on that. So things that I try to keep and talk to survivors, that these the things that we talk and we would like to adapt, and please keep secret on that and kind of thing. So yeah, definitely and if you have anything you can say to me.
All right.
I would like to talk more.
Yes. Well, I want to be cognizant of everyone's time. I know it's quite late in some places and early, and people are getting started with their day in others. And so thank you again, everyone, for joining. And especially thank you to you, Tipparat, for a wonderful presentation. And you did it on your birthday, which I didn't realize. So thank you for taking time away from your special day to speak with all of us. We really appreciate that. And I'm happy Chuka pointed that out. And I think we will see many of you in Thailand to hopefully continue these conversations about some of the amazing work that is happening related to violence against women around the world. If you have any questions, please feel free to reach out, but we will share the resources from this webinar this week. And then we are working on a webinar series with the Sexual Violence Research Initiative out of South Africa for the coming year. And so look out for more announcements about some joint webinars that will also cover some really exciting topics. I hope everyone has a great day or night, depending on where you are. And thank you again so much, Tipparat, for your time and your expertise.
Thank you so much. See you in Phuket, Thailand.
See you soon. Bye-bye.
Bye bye.